Back in 2007 was our first introduction to leukemia with my son James, who was just turned 2 at that stage. My eldest child then was only 3, and my husband and I, we run our own business, so it turned our world completely upside down. It was exactly 10 years within a couple of months of James being diagnosed that Kate was diagnosed. Kate, she started bruising on her skin, she became lethargic, and I immediately just had this awful gut instinct that we were doing this again. So we went straight to Crumlin, and I was quite abrupt with the team in A&E. I said, this could take hours. Can you just do the blood tests? Because I know you can tell very quickly. And, they were hesitant because obviously we were nobody to them. I had remained friendly with Prof. Smith, thankfully. So I text Prof and I said, I'm here with my youngest, he'd never met Kate. And I said, I need them to do blood tests. It sounds like we're down this road again. And he got on the phone. And within an hour, she was diagnosed. So that was whilst it was a shock the first time with James, this just felt very cruel. We knew what was ahead. Well, we thought we knew what was ahead. My memory of what James had gone through was what I expected Kate to have to go through as well, and that length of time. That was before we discovered that things had changed in those 10 years. Lots had changed, actually. The hospital had changed. The ward that we were going to had dramatically changed. And that gave us huge hope. And immediately we were positive. I was immediately going, okay, this is actually doable. This is okay. And we took a very different approach with Kate than we had with James. We weren't remotely as terrified. We were much more equipped from knowledge. We discovered that immediately her treatment would be less. Like James is over 4 years. She was done and dusted in 2.5 years nearly. Plus the prognosis. At that stage, she was in the 90 pluses. James had been in the 80s. And in those 10 years, it had jumped that a huge amount. We didn't know anything about clinical trials. They explained the technicalities of it and all that, but you're in such a whirlwind. A little bit of that goes over your head. For me, it certainly did, and all the different drugs and everything. Now, over the years, I became very in tune with everything that was going on. But at the time, all we thought about was, if this can help somebody else, then of course we're going to do it. And we trusted the team, and it was a no-brainer for us to do it. If I had known back then, when James was sick, the impact that it was actually going to have on us as a family 10 years later, I would have been canvassing on the ward, saying, everyone get in, do the clinical trial. You've no idea, we're going to be there again in 10 years' time. We are the typical example of why these clinical trials are so important. I have memories of some of the drugs that James had to endure, and side effects were really hard on his little body. And Kate didn't have to do those. So you're immediately ticking boxes going, oh, yippee, that's not there. The positivity that you can pull for that is enormous. And it's amazing in 10 years, between the 2 children, the amount of change that happened because of the trials. I can't express enough. I can't. It's for us, it was critical. And it made the difference, a huge difference.
Roughly speaking, around 200 children and young adolescents with cancer, and they're this sort of age group between 0 and 16 years of age, are diagnosed in Ireland every year. And the types of cancers, the biggest one is acute leukemia, and especially a subgroup of acute leukemia called acute lymphoblastic leukemia. And that is the commonest cancer in the under 20s as well. Survival rates are great, much, much better than we see with our colleagues in adult cancer medicine. Roughly speaking, it's around 80 to 90% cure rates for all cancers. That's all comers. Some are better than others, like Hodgkin lymphoma, it's around 95, 98%. Acute lymphoblastic leukemia, which is the bulk of these cancers, we're curing around 90 to 95% of these tumours.
Clinical trials set out to identify whether an intervention, for example a new drug, can change the outcomes for patients with a particular disease. And clinical trials do this by, in a systematic way, enrolling patients, randomizing them to receive, for example, a drug or a control, and then following them up carefully over an extended period of time to look at their clinical outcomes. Clinical trials are broadly of two types: those that are funded and sponsored by industry, and those that are investigator-initiated. And here at the UCD Clinical Research Centre, we're particularly interested in supporting investigator-initiated clinical trials.
The partnership is really important to us. It really allows us to expand, and it allows us to expand into more types of clinical trials. So the ones that we've been predominantly doing in the National Children's Cancer Centre have been phase 3 clinical trials, but we want to go now to phase 1 and phase 2 trials, as well as investigator trials. And to do that, we need more people, and this partnership allows us to expand, because UCD Clinical Trials Programme here has a very expansive portfolio, and we need to tap into that for the benefit of our children, adolescent, young adults.
Here at the UCD School of Medicine, we're delighted to partner with Children's Health Ireland. This bringing together of the expertise in oncology and haematology with our expertise in clinical trials and clinical investigation. It offers us really significant opportunities to improve outcomes for children with cancer in Ireland.
It's always difficult to predict the future, but what I would like to see is this partnership growing, and that every child who's diagnosed with cancer is offered a clinical trial. Patients who go on to clinical trials live longer. Their quality of life is better. So my vision for the next 10 years is when I retire, that all children, adolescent, young adults are on a clinical trial. I'll be able to sleep.
I was too young to understand at the very beginning, but at the end, I was old enough to understand what happened and all. So, I'm grateful that I was able to go into the clinical trial. When I came home from the hospital, I remember I walked up to my bedroom. My sister and her friend had a welcome home sign and all. And that actually made me feel a lot happier. I want to do veterinary when I'm older, so that's kind of what I want to do, or something medical, so that I can help other people get better.